saw a patient in the clinic the other day, a 40-year-old woman whose father had had a heart attack, and she was worried about her risk of developing heart disease. What do you think about a patient like this, and what should we be advising them to try and mitigate their risk of heart disease going forward?
Family history is one of the most important risk factors in terms of development of coronary disease. And of course, sadly, there's not much you can do about your family history. But there's an awful lot that you can change in order to make sure that the same thing that happened to your parent is not going to happen to you. And so if I was a general practitioner and I saw a 40-year-old whose parent had just had a heart attack, the most important thing I'd say to them is you mustn't smoke. You must stop smoking. If you're smoking, you've got to stop smoking straight away. And usually if your parents just had a heart attack or something, you can usually convince people that now's a good time to change your life and stop the cigarettes. Now, the use of statins is very controversial in this group of people. The only evidence base that there is for the use of statins is in people who've actually had a heart attack themselves or a stroke or have had treatment for coronary disease. In these people, if they have an elevated cholesterol, they should definitely be on statins, and some would argue they should be on statins no matter what their cholesterol is. In all other groups, there is no evidence for the use of statins. But of course, having evidence for the use of something is not the same as saying they shouldn't do it, because if you're a 40-year-old whose parents had a heart attack and you don't smoke and you exercise and you're slim and you don't have diabetes, what else can you do to change to change your outlook? And statins in this group, I think they're probably really important. And certainly, to use some personal history, I'm pretty much describing myself. When I was in my 40s, my father was a smoker. He'd had heart attacks. My cholesterol wasn't particularly elevated, but I chose to start myself on a statin even though I had no symptoms. All I had really as a risk factor was a family history.
What are your thoughts on the use of statins in patients with high cholesterol, or certainly in patients like the 40-year-old lady with a family history of heart disease?
I've been taking statins for the last 15, 20 years. I don't have any side effects, and I personally believe that not very many people do genuinely have side effects. And I can't say that the statins have done me any good, but I think if I hadn't taken them and I had had a coronary event, I'd probably regret that I hadn't taken them. So, from a personal perspective, I don't have any problem in being on statins, and I don't have any problem in telling my patients that I take statins.